Hey guys, welcome back to Alpha Physiopelvic Care, all things pelvic health, and I must say beyond. My name is Anastasia Varova. I'm a pelvic floor physiotherapist. I also have extended experience in musculoskeletal background, and my love and passion and all my being is in the work with the pelvic floor for both male and female, as well as generally healthy body, healthy pregnancy, healthy post-pregnancy period, and generally quality of life that is incorporated together with the pelvic health. Today, I would like to talk about pubic symphysis pain in pregnancy. In my previous videos, I had my belly in. Today, I didn't put it, but this specific video is for pregnant people who are suffering from pubic symphysis, which is pain in the pubis in pregnancy. And most of the time, this pain will develop in pregnancy. It can get bad, it can get worse throughout the pregnancy, and in vast majority cases, not all, but vast majority cases, it will resolve very soon after birth. Okay, so it's a little bit a mystique condition in one sense. In other sense, there are management strategies we can use to improve quality of life, especially in pregnancy. So what is very shortly what is pubic symphysis? Because it's not a theoretical lecture, today I'm here to show you some practical tips, some practical exercises what to do. This cartilage here in between, that is in between two pubic bones, it's a very, very necessary thing, believe me. So our two pelvic bones can move freely. Well, this model doesn't move, but in a real body, they move. They can expand slightly. And as a person gets pregnant, quite often this cartilage becomes kind of swollen up. And instead of its natural 5 millimeter width, it can become up to 9 millimeter. So it becomes looser and wider. And of course, there can be more instability in that area. But if you look at our pelvis, it also has other joints, not only the one in front, but also two at the back. These joints can also play a role, and it's very important to look at the whole posture, whole pelvis, at the lower back, and so on. And in my work, I always do the whole body and pelvis assessment. I don't look only on the pubic symphysis. Let's quickly run through do's and don'ts in the pubic symphysis, and then I will show you the exercises. So let me tell you first that this condition is not only physical. There is a research that kind of suggests that it has a psychosocial component to it. Obviously, it is a physical condition and there is no denying that, but psychosocial component means if mother has more stress, if she probably is already a mother, she has more children, if she has more anxiety, maybe generally about life or about coming birth, she is more likely to experience a severe pubic symphysis pain. So many people can experience it, but the psychosocial component can add severity. I myself did have a pubic symphysis pain. However, I had it very specifically from an injury. I slipped. I didn't step correctly, and this kind of gave me a bit of a shake, and I had a pubic symphysis pain, which was completely gone after I gave birth. So the do's. The do's is trying to keep your legs as together as possible. I mean, obviously we walk, but whenever we want to come out of the car or we want to kind of do any movements, we really try to avoid anything that gets our legs spread out wide, especially an asymmetric stance. If you're pregnant and you don't have pubic symphysis, you can do that. But if you have pubic symphysis, it really will be hard for you. And it's preferably to avoid. Contrary to many beliefs, we do want to avoid stretching it, okay? It might feel good in a moment because you might have some tightness in the adductors, okay? But if you keep stretching and stretching, due to the attachment of the adductor muscles, inner thigh muscles, to exactly your pubic symphysis, it will pull it apart more and more. I'd rather suggest you do a bit of massage here if you want a bit of release. You can do gentle stretching, but do not go overboard in stretching during pubic symphysis, especially in asymmetric positions. This stretch is not for somebody who suffers from pubic symphysis. So yeah, this is the main thing with do's and don'ts. Trying to make things symmetrical. If you lift, legs are symmetrical. Exercising, you can rotate, and symmetrical rotation. I have been doing many adaptive exercises to my clients in a group setting. When I knew they had pubic symphysis, I wouldn't put them on one leg, I wouldn't raise their leg, I would ask them to slide instead of raising, and so on, depending on the severity, if it's severe or not. I'm a big fan of osteopathy, chiropractic. If these people specialize in pregnancy, go visit those professionals. They helped a lot of people. They helped me personally. They helped my clients, and let's say we share clients, and I'm all for it, for multidisciplinary approach. Right. And the main do in the pubic symphysis is pelvic floor and core training. Because have a look, guys, how much attachment of the pelvic floor goes around the pelvis, including your pubic symphysis area. So when this area is strong, when the core is strong and the glutes are strong, you provide this support for the bones so that there is less unnecessary mobility, okay? And this strength is achieved through targeted exercises, through specific exercises. All right, that was the theory bit. Let's get to practical bit. Don't forget to subscribe and like this video if you find it useful. If you have pregnant friends, feel free to share it with them. When we talk about pubic symphysis, the small ball is your best friend. If you don't immediately have a small ball here, you can get a pillow that is maybe folded in half, something between your knees, okay? So what we are going to do is, I'm placing the ball in between my knees, and this will add activation of the hamstring, and when you press it, you will feel that also your pelvic floor and tummy gets activated. Even if you're 9 months pregnant, it's absolutely okay to activate your pelvic floor. Remember, symmetry. Hands on your waist, and you're dropping slightly here into your knees. You're taking nice deep breath in into your sides, and gently, gently arch your back, okay? We're not going into full-on arch, 50%. Breathe in. As you breathe out, start to tuck your tailbone in. Feel your pelvic floor engaging. You'll feel lifting your tummy, okay? Gentle squeeze of the ball. Breathe in, let go. Breathe out. Gentle squeeze of the ball. In. What I don't want is exaggerated movement. I don't want this and this, okay? It's very mild, 50% effort movement. Make sure you avoid doing this with your legs, all right? So you have to keep your feet quite close. I would even say if you feel like ball is pushing you apart, that's fine, because as we gently squeeze it, we're gonna get our legs parallel. So breathe in and breathe out. You can do 15-20 repetitions of this exercise. And out. Nice. This is in standing. You can also go against the wall. I'm placing the ball now, my sacrum. And again, it will give you like a feedback on what to do. You're gently engaging your tummy and pressing into the ball. Legs maximum parallel. They can be slightly more together, but max parallel. Breathe in. Breathe out, you gently press into the ball. And if you have a belly, already big belly that you can see, you can feel, you will feel that belly lifting. Breathe in and out. Another great exercise is going onto your knees. Again, asymmetrical exercises on hands and knees usually are not very well tolerated. Somebody who has pubic symphysis, Here you can just place the ball between your knees, close enough that you feel that it's squeezed. You can start with gentle rotations, see how it feels. If this rotation does cause you any pain, or is it okay? Right? And then my favorite drop back with the assistance of the ball. Breathing in, breathing out. You tuck your tailbone in, gently engage your tummy and make a small drop back. Small, guys, all right? We don't want to go arched. We don't want to go full on, what do they call them? Norwegian deadlifts, Scandinavian for the hamstrings, right? We want go gentle drop back. Long breath, feeling the engagement. Breathe in, considering that you have a belly. We feel tension here, everything supports our pelvis nicely. Engage pelvic floor first. You feel that tummy lift. Yes, you will feel glutes and hamstrings kicking in. Breathe out. And you can repeat this exercise 15-20 times. And then another one, great one. I'll place my lovely pelvis here. Arms and legs parallel. Wave. We're going to breathe in, dive under. As you breathe out, we transfer a bit more weight onto the hands. You start to tuck your tailbone in, engage your lower tummy. Breathe in, gently arch. Breathe out, tuck your tailbone in. You will feel the tummy going in. Breathe in. Depending what's the severity of your pubic symphysis, you can make larger wave or smaller wave. So if you feel not that much pain and you feel you can go more, you can go under, a little bit more forward. Breathe out. Breathe in. Engage, breathe out. If you have a lot of pain, small wave. You're going just gentle arch, move a little bit forward, engage your tummy. All right. Another variation, if you're tolerating standing position, not very good, you're getting tired and so on engaging your inner thighs, is being on your side here or even here, okay? Here you will switch on a little bit more side abdominals, lifting your waist up, nice deep breath into the side, engaging your pelvic floor, engaging your tummy, gentle squeeze. Breathe in, let it go. We do not want to squeeze the life out of the ball, right? We want to give it a gentle hug with our knees. In. We do this on both sides because there is more work from the top leg. Bottom leg is kind of stabilizing, so we do want to switch. These exercises are not very hard and demanding in a sense of they're not strenuous on the body. So I would suggest you can do them every day. You can choose between 5 and 10 minutes routine. You can do all of those exercises. You can choose a couple of them and do those exercises and try to monitor your progress. However, if the pain is really severe, I would also suggest you to see a healthcare professional. Maybe you might need to have a support belt. There is support belt for the whole back. There is specific V-shape support. It's kind of like knickers, let's say, something like shape here. All right, so there are different options available to manage the condition. And as I said in the beginning, usually the good news is in vast majority cases, pubic symphysis will get better after birth. Okay guys, I hope you enjoyed this video. I hope you find this useful. Let me know in the comments if you have more questions, more explanations, more suggestions. I really would appreciate that. Don't forget to like and subscribe, and we will see you very soon again. Bye bye.